Cervical screening is so important, but of course, a major barrier is that many people find the idea of cervical screening embarrassing or awkward. It can be uncomfortable for some women too, although most women don't experience any pain. So we try our best to make things as comfortable as possible for you, and if you have any questions or particular preferences, we will try and help. Or perhaps, if you are particularly worried, you could ask for a longer appointment to go through things slowly and ask any questions. You can stick some headphones on or bring a friend, whatever you need to make you feel comfortable. Some people may want to choose the gender of the clinician performing the test. In our practice, usually it will be a female nurse doing the test, and you can have a chaperone present if you wish. Usual rules around privacy and confidentiality apply, so we don't go shouting to everybody about why you are here. We know that this may be a particular concern for trans men, for instance. If you have a history of smears being particularly painful, it might be worth mentioning, as perhaps we can use a smaller speculum, or we could use some additional lubricant, or sometimes, and particularly if you are prone to vaginal dryness and irritation, a course of estrogen cream or a pessary can be used for a few weeks before the cervical screening appointment and then stopped 2 to 3 days before the test itself. As a last resort, women can be referred to a specialist for support if it is impossible to perform the test at the surgery, although this is rare. During the test itself, we will pull a curtain across, lock the door so nobody walks in. You'll usually lie on your back, your lower half is covered by a clean sheet of paper. You usually bend your knees with your ankles together and flop your knees apart. Sometimes we might ask you to sit on your hands and make them into a fist. This is to help visualise the cervix. We keep you covered up until we are actually doing the procedure, so you are exposed for the least amount of time. The nurse or clinician will insert a speculum into the vagina, which looks a little like a duck's beak. They are usually plastic, although can be metal, and there are different sizes. We put lubricating jelly onto the speculum to make things a little more comfortable. The speculum is opened up so that the healthcare professional can see the cervix, which is a round tubular structure. A plastic rod with a soft brush on the end is put into the vagina and the brush is rotated upon the cervix. Occasionally that action can cause some light bleeding or spotting, which usually settles within a few hours. The brush is put into a bottle of fluid and sent to the lab in Manchester for testing for the HPV virus.